New product idea, disposable chaps.
Yeah, yeah. Or autoclavable.
Hey everybody, thanks for joining us again. I'm Mike Russ with ProEdge Dental Water Labs, and I am thrilled to be talking to India Chance again.
Hi guys.
Who is the greatest.
Hey Mike.
India, can you give us some fresh guidance? It's almost the first. There's been some new updates, some new interim guidance on reusable cloth gowns versus disposable PPE.
Yeah. So that's just coming from a place where there's still a PPE shortage. And so the CDC has an interim guideline where they are recommending that clinicians transition to cloth gowns or reusable scrub jackets and lab coats. That way, they can leave some of those reusable gowns and jackets for the frontline medical care workers in hospitals. But also, when you use a disposable gown, what happens is if you do have to remove that to use the bathroom or go into the lunch area, sometimes they utilize ties that tie behind your neck and tie behind your waist, and you have to pull it and break those ties in order to go visit the restroom or the lunchroom. And then when you go back to use it, it's not going to fit properly, and therefore it's not going to protect you properly. So they're saying just, transition to reusable lab jackets, lab coats, and also gowns. One thing for dentistry would be a good idea if you haven't in the past is to definitely transition to maybe longer lab coats or longer gowns, because when you sit down, your scrub pants are exposed and all the aerosols and everything, and this could be used even moving forward. And so the thigh area tends to be very, very contaminated, which people don't realize. And so even though you remove that reusable jacket and that gets laundered, a lot of us wear our scrubs home, and so we take all of that kind of contamination home with us. Sometimes our kids run up to us at the end of a long day and they hug us and grab our legs, or the dog or the cat or whatever, who knows. And so, or your spouse or whatever, and not that they're grabbing you around your legs, but what I mean?
Unless you're playing football.
Maybe you're sitting on the couch and they lay their head on your lap or something. I don't know. But yeah, so that's why they're saying to maybe transition to longer types of gowns and protective clothing. Mm-hmm.
Wow.
Yeah.
You have to use proper technique when donning and doffing as well.
Yeah.
Do you need to cover the gloves? Need to come up over the cuff?
Yes. So at the wrist, it should fit tightly. OSHA has language saying that it should fit tightly around your wrist, and then that way, when you're putting the gloves on, it goes around that wrist area, that piece, that band that's normally there at the wrist, and you have nice protection around there. So no exposed skin really is the goal there. So.
Yeah, and that's a really good point about lower legs being exposed. Is that and you never think of it, but that's exactly what could happen. You go home and you protected your upper body, but not your
right. Yeah, exactly. Because a lot of clinicians still sit; they don't stand, and so all of that, it could, and it doesn't have to be aerosol. It could be splatter. It could be water. It could be whatever materials that were in the patient's mouth and it, flew out or whatever. Could be on the thigh area. So yeah, so that's why they're recommending longer garments.
New product idea: disposable chaps.
Or autoclavable.
Autoclavable chaps. Invented by us. India Chance, Mike Russ, get the royalties on that one.
Right. Exactly. Yeah, that would be great.
Good stuff.
That's funny.
Good stuff again, India. Holy cow. Let's do it again soon.
Yes, definitely. Let's. Thanks so much for having me.
Thanks very much.